Welcome to Pediatric Pioneers, a MedBridge podcast where we conquer challenging topics for the pediatric therapist through conversations with pioneers who have blazed new trails in our practice. Our aim is to deliver actionable takeaways for practitioners like you. To receive continuing education credit for this episode and access bonus resources, make sure you check out medbridge.com. Hello, I'm your host, Nicole Quint, and I'm an occupational therapist with over 20 years of experience in practice and academia, specializing in pediatric practice and the improvement of occupational participation and performance through my expertise on executive function, visual perception, social-emotional learning, sleep, and sensory processing. It is my passion to support pediatric therapists like you so that you can best serve the families under your care with evidence-based practice solutions, easy-to-implement advocacy approaches, and new ways to lean into your skills within the challenging pediatric landscape. Hello, everybody. Today, I'm excited to be joined by Dr. Susan Bazyk, an expert in occupational therapy's role in addressing the mental health needs of children and youth. We'll be diving deeper into this topic, including recent research and actionable takeaways you can implement right away. Welcome, Sue. Could you get us started by sharing a little bit more about yourself?
Okay. I'm an occupational therapist, and I've specialized my whole career in working with children, youth, and families, including infants, birth to 3, for 45 years. So I've been a clinician, an academician, and a researcher. I'm a professor emerita, which means I retired from Cleveland State University in 2018, where I taught for 34 years. And I taught all the pediatric courses, so all the courses addressing children and youth. And I also developed a graduate certificate program in school-based practice in 2000. We saw back then how important our knowledge and specialized knowledge needs to be in working in schools. And now, school practice is the third largest practice area for occupational therapy practitioners. So this certificate really prepares, it's an add-on to the entry-level program to help therapists really be prepared to work in school settings. I also am a Fulbright specialist, and that means that other countries have had the opportunity to host me. I presented on Every Moment Counts, which I'll be talking about in New Zealand in 2020 and Ireland in 2023 last fall. And I also have presented in other countries across the globe, and I know that this work that I'll be talking about is relevant across the globe. So I'm really excited to share.
And we're really excited to have you. You are definitely a pediatric pioneer, and I'm really privileged to have you talking about all of your work. So tell us a little bit more about what initially attracted you to occupational therapy's distinct contribution to children's mental health, and how your passion has evolved over time. This is obviously a huge topic these days.
Right. It's so huge. I guess I have to say, since I've been an OT, I always took very seriously our role in addressing the mental health needs of the people we serve. So in working with infants who refused to eat, they were tube fed, I always tuned into and even published on addressing their psychosocial needs. But in 2000, there was a very pivotal meeting that I attended. It was a think tank meeting that AOTA hosted. They invited, it was Barbara Hanft, a leader in our field, and Leslie Jackson, who were the pediatric coordinators. And the impetus was the Surgeon General's very first report on mental health in 1999. 1999, the very first report on mental health. And there was a whole section on children's mental health. And so the impetus for this meeting was we read that report, and 20 OT researchers and practitioners met to really think about what were we doing in our field, in our publications, in our practice. And we identified a huge gap. You know, we only had a few chapters on addressing the behavioral needs of children, children who had identified mental health challenges. But the Surgeon General's report advocated for mental health promotion and prevention. let's not wait till people are ill to address their mental health needs, but what can we do to promote positive mental health? And so after that, around 2009, I read a monograph that came out by Georgetown University, and it was a public health approach to mental health. I was so excited reading that monograph, and I said, this is exactly what we need. So I had opportunities from AOTA to publish. We have a school mental health toolkit, but it was really that 2011 book that I edited along with OTs, and we applied this tiered approach to mental health to occupational therapy practice. It was so exciting to do this work, and I knew that we needed to get this work, this information, into the hands of practitioners. So the other thing, you mentioned distinct value. I think what's very critical is that we need to articulate how we're different from other mental health providers. And what we do as occupational therapists is help people participate in the occupations and interactions that help them be mentally healthy. So in a very simplistic way, I say we don't do talk therapy, we do doing therapy. And that's really what makes us different than school counselors, psychologists, etc. We know PEO, person, environment, occupation. We know how to analyze the environments, the tasks, and a person's skills to help create participation. And so to me, that's really critical.
Yeah, and I think this is, you're talking about our distinct value in addressing children's mental health. We're born out of the psychology and mental health background, and I think sometimes we forget about that. And then, we know in the school settings it's so important. So what do you think occupational therapy practitioners need to do to move us forward in this area? You talked about, making sure that we're able to clarify what we do and why we do it, but how can we move forward? Because that's a challenge.
Yeah, and I do think we have two challenges. First of all OT practitioners have entry-level knowledge in addressing the mental health needs of people across the lifespan and in all contexts. But one of our challenges is that I think a lot of programs in the past, entry-level courses focused on only Tier 3 or providing services to people with mental illness, especially adults. There was not much about addressing children's mental health. Mm-hmm. And so, unfortunately, I think we defined in the past mental health OT as that which is provided for people with mental illness in traditional mental health settings. If students come out of programs and that's the only way it's defined, then they don't really know how to apply our knowledge of mental health in other settings, in rehab settings, in school settings. So then what happens is sometimes practitioners in schools, and I've heard this happen, that OTs in schools will say, no, I don't address mental health. That's not a part of my scope of practice. So one of the challenges, we need programs, we need workshops, we need publications that help occupational therapy practitioners, or OTPs, to apply our knowledge of mental health in a school setting with, children and youth. So that's number one, I think is really critical. The second challenge is we need to articulate our role and how we're different from other mental health providers to interdisciplinary professionals in schools. And we can't just talk the talk or explain what we do. We have to demonstrate our value. So if school principals, if teachers only see OT practitioners addressing fine motor, handwriting, sensory processing, then that's how we're defining ourselves to others. And that's how they will define us when they have new hires. It's really our fault. But if we talk about mental health and demonstrate how we address the mental health needs of children and youth, and we address participation in lunch, recess, play, leisure, then other professionals will learn about our full scope of practice. So that's another thing. We have to really articulate and talk about our full scope of practice and demonstrate it.
Mm-hmm. We have to walk the talk. I like that.
Right.
Yeah. And I think, that's an interesting point about scope of practice. We have a wider scope of practice than we are exhibiting in the schools. And so, you're saying that we need to do, and we have to do better to show what that scope is, and not only talk about it, but to expand it in our practice. So how do you propose that we speak about our full scope of practice in school-based practice to other professionals, to prime them, I guess I should say, for when we start to do it, that it really sticks?
Well, I think there's also two prongs there. First of all, we need OT practitioners to think more in a top-down, occupation-focused perspective versus just bottom-up, which would be performance component. So if we focus heavily on our role in performance components like sensory processing, fine motor handwriting, which are all very critical, then again, others will define us as sensory processing OTs, or I've heard others say that they'll include OTs related to a mental health issue if there's a sensory need. That's really a problem. So getting back to scope of practice, I think we need to really help therapists be able to visualize those areas of occupation as defined in the OTPF4, the Occupational Therapy Practice Framework, those 9 areas of occupation, and really maybe have materials that depict those 9 areas. I will be sharing in the follow-up handout a link to a graphic that I helped develop with other OT practitioners that depicts those 9 areas of occupation and how we apply that in schools. So I'm not sure if we're answering that question, but I think printed materials would help, but also demonstrating how do we address play. Play is an area of occupation that is within our scope of practice. That means we really should automatically be present during recess to help children play, engage in healthy play. Meal times is a part of ADLs. We should automatically be influencing participation during lunch. And really, since the pandemic, I'm hearing more and more social participation, behavioral challenges during lunch and recess. These are unstructured times of the day. So children, I think, are struggling more with those unstructured times and knowing how to participate. And we can have a critical role as, I think, promoting health during those two times of the day specifically.
Well, I think, what I'm hearing from you is not only to talk it and give them handouts, give them written opportunities to take it in, but then to make sure that we are doing it, like you said, but we are doing it in the places that occupations happen in the school. So making sure that we're being seen on the playground, in the cafeteria, not just one designated space. And so I think that's important for therapists who do have a sensory space, that they're not just staying in there, that they're getting out and taking what they're working on in those occupations in the real context that it's happening. So I think that that's important. So, that makes sense to me. But, I'm curious, this is exciting because there is such a need for mental health. And I think the preventative approach and expanding those tiers is really important. So what does the recent research say about mental health in the schools? Can you give us some highlights of the most important takeaways so we are using evidence-based practice?
Sure. And I've had an opportunity to write a chapter on school mental health for the primary OT and mental health book by Stoffel, Brown, and Munez. So I just completed a recent review of the literature, and current research in school mental health across the globe advocates for this tiered approach to mental health, which I'll elaborate on a little bit. But what was really exciting in some of the recent research is that there's more emphasis on the need for Tier 1 and Tier 2 mental health promotion strategies by interdisciplinary school teams. So in a way, we need all adults serving youth to have some knowledge of what mental health promotion and prevention would involve. And Canada, for example, has some excellent materials under their website, mentalhealthliteracy.org, on teaching teachers how to teach mental health literacy in elementary and high school. So that's the movement I'm seeing, a lot more on Tier 1 and Tier 2. Now, a recent publication by Hoover and Bazyk, and that will be listed in the follow-up information in 2021, I was also very excited because they listed occupational therapy as a profession that contributes to Tier 1 and Tier 2. And the reason that's so exciting, that was the very first publication I ever came across that listed OT. We are an Indigenous resource in schools that can contribute to school mental health, in addition to counselors, school psychologists, and school nurses. They're usually listed in a lot of publications, but we're not. But this publication was also exciting because Hoover is the co-director of the Center for School Mental Health. It's a national center for school mental health that hosts a national conference each year. And I don't think we were listed or acknowledged as a mental health contributor just out of the blue. Really what happened since over the past, I would say, 15 years, under the leadership of Sandy Shefkin, who was the pediatric coordinator at AOTA, she really encouraged OT practitioners to present at the Center for School Mental Health conference every year, even if it was 2 or 3 sessions. And we, I think because we keep doing that every year, and that other professions are starting to see that we are Indigenous resources that can contribute to school mental health. And then the other last point I want to make is OTs in schools have to know legislation, both IDEA and then our current legislation it's called ESSA, Every Student Succeed Act, advocates for MTSS, or multi-tiered systems of support, which is this tiered approach to health, both mental and physical. So in addition to research, we really have to ensure that OT practitioners know legislation and are advocating for our role because we are written into the law. So we're very fortunate in the United States under IDEA, that opened the floodgates, that students with disabilities, if they need our services to benefit from special ed, we need to provide that. And under ESSA, we're identified as specialized instructional support personnel that can contribute to creating school environments that promote health and participation. So need to know legislation.
Yeah, and that's a tough one. You know, we think of ourselves as being in healthcare, so we have to also learn the system of schools as well, the school system, to truly understand how we can maximize our role. But I really appreciate what you said about expanding and presenting at non-OT conferences, because I think that sometimes we stick to AOTA or our state OT association conferences, and we really need to get out there, because I think when other professions recognize that, that's where we're really going to make the most headway, that we are able to be on these teams and work within the scope, because then they're seeing us differently. It's not just us advocating for ourselves. So I think that's really important.
Yeah,
so
it's so critical.
Yeah. And so, this research is really exciting. Moving towards this preventative model, I think, is really important. So I want to talk a little bit about how, we translate that research into school and even clinical settings that therapists are working in. How can occupational therapy practitioners apply this tiered approach or this preventative health promotion approach to mental health for children?
Yeah, great question. Well, in 2011, when the book came out, I was so proud, so excited about this information. But I knew that if OT practitioner didn't read it, that they wouldn't learn about it and it wouldn't be applied. And we know that only a small portion of research is ever read and applied, and that it takes 17 years to translate new knowledge to practice. So I went to a conference in Toronto on knowledge translation and implementation. It really opened my eyes to the fact that researchers really need to take an active role in knowledge translation. And how that happens is through bringing communities of practice together, so people who have a shared interest in a topic, and to engage in shared learning and shared work over time. So I had this idea. I developed my first community of practice in 2011. I invited 14 OT practitioners from diverse school settings, and I asked them, will you join me for 6 months? It wasn't a lifetime commitment, but I said, how about 6 months? We could do 3 face-to-face meetings to build community, but then they each got a book and they read 2 chapters at a time and engaged in online discussions. This was in 2011, before Zoom and our use of all of that. But they were so excited about learning about this framework and thinking about how to apply it within our scope of practice. So it was so exciting. And we heard about funding through the Ohio Department of Ed, and they were interested in grants related to school mental health. So I went back to these 14 OT practitioners, and I said, now that you understand this framework and you think about our scope of practice, what's missing in schools and what do we need to do? And it was during a 3-hour meeting that we envisioned Every Moment Counts, promoting mental health throughout the day. I wrote the grant. We got funded for 3 years. And it was during those 3 years that I had these change leaders already primed to help with the development, implementation, and evaluation of the initiatives that I'll be talking about in a little bit. So I do believe that innovation requires researchers and practitioners to work closely together. And researchers can't assume that just because something's published, that it's going to be read and implemented. So it really changed all of my work.
Yeah, and with Every Moment Counts, I think people can see the potential of starting something and letting it grow into this bigger movement. Mm-hmm. Can you share a little bit more about Every Moment Counts?
So Every Moment Counts, some people refer to it as a program. It's really not a program. It's a multi-pronged mental health promotion initiative. When we were envisioning this, we knew from the literature that there was a lot of attention to what to do in schools with children and youth with identified mental health challenges. But there really wasn't much on promotion and prevention. So we focused on Tier 1 and Tier 2 mental health promotion and prevention. And initially, we really focused on OT's role. So everything on Every Moment Counts website, which is www.everymomentcounts.org. When you look at it, even though it doesn't just say occupational therapy, Every Moment Counts, we're presenting what all frontline school personnel can do to help with participation throughout the day. So there is an OT lens to it. There is a section on the website under the about occupational therapy. I highly recommend you look at that portion of the website to learn more about articulating our role in schools. So within this tiered approach to mental health, let me just very briefly, Tier 1 are universal strategies that can be applied in a whole classroom or even in a whole school. And the focus is on embedding strategies known to promote positive mental health. So on our Embedded Strategies tab, I have 10 evidence-based mental health promotion strategies that can be applied. So I'll give you an example. One that is not discussed very often or maybe thought of is mental health literacy. And what does that mean? It's helping all children and youth know what positive mental health is and what to do to be healthy mentally and to take care of their mental health. And also to know what to do if they're having early signs of not doing well emotionally and coping with that. Tier 2 strategies are more specific for children and youth at risk of mental health challenges. And there are a lot of children that fall in that category that probably aren't diagnosed with a mental health challenge at this point. Because mental health and mental illness, it's not black or white. And so a lot of times there are subtle changes in children when they're starting to develop mental health challenges that could be overlooked unless there are adults in the environment that tune in to sleep, hygiene, concentration. All of those are types of behaviors that can change when someone's not doing well emotionally. So at Tier 2, we offer accommodations in the classroom. We can offer sensory supports. A lot of times there are sensory challenges. And then also small group interventions, and I'll be giving some examples of that during lunch and recess. And then Tier 3, at Tier 3, what could we do alongside the other mental health providers to help students who struggle emotionally be able to participate successfully in school? And that's where these accommodations, again, come in, and advocating for 504 plans, which would be the accommodations.
Yeah.
So, another part of Every Moment Counts is these initiatives that we've developed, and they're all on the website. So I've mentioned the embedded strategies. We hit this hard because we were hearing therapists and teachers saying they can't do one more thing. But if they have a knowledge about how to help children be mentally healthy, how can that be embedded throughout the day? There's an integrated services section of the website, and that part is really important to help related service providers know how to move from a one-on-one type of intervention to integrated and natural settings. And I'll be talking more about that. Other initiatives, the Calm Moments cards, 3 therapists, one is an OT assistant, and myself, they really felt the need to educate frontline personnel about how to identify stressors when children are stressed and how to embed evidence-based strategies to reduce stress. So we call this the Calm Moments cards. That really includes some simple but evidence-based strategies, thinking strategies, calming and focusing strategies, and sensory strategies to reduce stress. Another 2 programs are the Comfortable Cafeteria and Refreshing Recess. And these programs they're push-in programs to help supervisors learn how to effectively supervise large groups of children and to foster the soft skills that are important during these times, such as how to be a good friend, have a meaningful conversation, respect differences and include others, and then for the recess program, engaging in active play. So both of these programs really focus on healthy behaviors during lunch and recess. They're such critical times of the day. And then the last initiative is Making Leisure Matter. I often say that leisure is a forgotten occupation for a lot of OT practitioners. So what we did, a lot of the therapists involved in our work were saying that children are often just sitting at home in the evening, playing video games, and the children at risk for leisure deprivation are those children with disabilities, highly, that occurs a lot, and those living in poverty. But we know from the research that children and youth who have at least one healthy leisure activity do better academically, socially, and emotionally in life. So this whole initiative uses a coaching strategy to help children who have leisure deprivation to talk about the benefits of leisure. We use interest inventories to help spark an interest. Sometimes children don't know that there are activities such as pottery for bird watching. And if they have an interest, then we help them explore community-sponsored activities, get the parents involved, and really use coaching again to help them participate in an activity that they are interested in.
Mm-hmm.
So those are the major initiatives, and everything, again, is on the website to help you learn more about them.
Yeah, these initiatives are exciting. I think about them when you were explaining them, about how they would really reframe how other professions view us as part of the school system team. Because, if you start seeing all of this, you start envisioning all these opportunities for OTs to make a difference with the kids. And what a privilege to get to work with a child and help them identify something that's meaningful to them that they can now transform their life with. And I think that we don't maybe always think about that opportunity that we're in to change someone's life that way. And leisure really could do that.
Yeah. Oh, we've seen
exciting.
Huge benefits, and I will share some success stories. But really, it's for some students with disabilities, school is really hard. They have to work so much harder. And if they have, and even students with mental health challenges, school might be very difficult. A lot of students with ADHD, school is never maybe going to be their favorite thing. But if they have something that they're excited about to do after school, that could get them through the day and something to look forward to. So sometimes it's what children do after school that really adds so much meaning and joy to their life.
Yeah, and I think that shapes their identity as an occupational being. And you're now you're in that opportunity to help them go from thinking of themselves as a bad student, maybe that's their identity, to now all of a sudden they have this identity that's one of strength.
Right, exactly.
And that's amazing. So, it's and I remember your book, by the way, in 2011. It kind of changed everything in my thinking. So thank you for that.
Oh, good.
Is it accurate to say, you kind of said this earlier, that occupational therapy practitioners traditionally focus on tier 3 interventions? That's kind of what we think of, that one-on-one service delivery model. And so knowing that, I guess I don't need to ask you because you really did say that earlier. How would you advise a school-based occupational therapy provider to expand to providing interventions using some of these initiatives at a more population-based level? I think we don't do that enough, thinking about the small groups and how good we are at running groups. We forget about that. And how fun it is, by the way. It's a lot of fun. I loved doing my lunch social skills groups. Those were so fun. So if we did more population-based level, therapy, if you will, and provide interventions for tier 1 and tier 2 where we could be really effective, how could you advise folks to do that?
Yeah, I think we have to really break out of the individual one-on-one therapy model. So under IDEA, Individuals with Disabilities Act, I think we will always have OT practitioners who have caseloads of students with disabilities. But what we have to really realize, the law doesn't state that means we do individualized therapy. First of all, the law mandates that we provide services in the LRE, least restrictive environment, which means to the maximum extent possible, we should be providing students with their non-disabled peers as much as possible. And to do that, we should be in natural contexts. So it's also important to realize children don't go to school to receive therapy. They go to school to participate in the school day, in the classroom, lunch, and recess. So it all goes down to participation with a capital P is so important. So I think one of the things we need to think about and talk about with therapists is, how do we move from one-on-one? What other service delivery models do we need to have skills in? And for a long time in schools, I think it was one-on-one or consultation. Consultation is okay, but sometimes just asking teachers to do more is not effective. They need to see what we do. They need to see what we do through modeling And one of the strategies for doing that is going into the classroom and using co-teaching strategies. And it was our wonderful late Jane K. Smith who turned me on to co-teaching and some of the work she did related to handwriting in the classroom. So co-teaching is going into the classroom. You could be co-teaching with a teacher or co-teaching with a school counselor. I have good colleagues who co-teach with school counselors the zones of regulation, which some school districts have adopted as part of their gen ed. And so when we're co-teaching, the teachers benefit from seeing what we do. And so that's an important strategy that I think we have to develop. Coaching strategies is doing with. There's more literature in occupational therapy on using coaching, and it's really starting that relationship with the person. So we use coaching strategies with the cafeteria and recess programs, not going in and telling supervisors how to do things, but working with them, finding out what their challenges are, and modeling the kinds of interactions we see. And then you mentioned groups, and groups are powerful. I don't think most professionals know that we all have taken courses in group process. And there is strong evidence to support occupation-based groups are really effective for promoting social skills and participation. So children can maybe get along with their OT and have great social skills, but what groups do is they help children and youth interact with each other. So lunch and recess groups, I agree with you, are really important.
And they're fun. Yeah. When I hear what you're talking about, and I know, like you were saying, the co-teaching is so important. I think that's underutilized. And like you said, teachers are going to push back and say, no more on my plate. And the embedding that you talked about earlier, we know how to do that. We know how to embed into routines. We know how to co-teach effectively, run groups. So I think these are all things that help us lean into our strengths. We are very collaborative. So I love these strength-based approaches that can help us walk that talk. And so I really would love to give folks some actionable takeaways. So talking maximal impact, what would be your top 3 actionable takeaways for therapists to put into school-based practice? And is there anything occupational therapy providers working in the clinic or home health maybe could do with some of these ideas as well?
Okay, I think one of the things in a very pragmatic way is for therapists, wherever they're working, to really have their laser eye on what the needs are. And I'm going to get a quick example. An OT assistant in one school, one of the children that she, on her caseload, the teacher was saying that the kids in her class were shutting down. This was after the pandemic. They were angry. They were having a hard time concentrating. What this very talented OTA did is say, well, I can help. Let me demonstrate some deep breathing. They did some yoga poses. So they were very short activities. And she did that a number of times. The recent research on mindfulness in schools is really supporting short activities to help with mindfulness. About a month later, this teacher talked to the OTA and said, now I know how to implement those activities, and my students are really attending much better. So keep a laser eye on needs. Another strategy, use the Every Moment Counts website. It's like a book. It's information dense. So I apologize a little bit for that. But it really does represent the work that we've been doing since 2012, since we were funded. This is the second iteration of the website. And we really give a lot of practical ideas for implementation as well as free downloadable information. So if it's overwhelming, I would start with one area of practice that you might see there's a need. It might be maybe there are a couple kids on your caseload who are struggling socially during lunch. Then I would hone in on the comfortable cafeteria. and think about implementing that. Go in and observe the cafeteria. See what's going on. Is it a sensory issue? There are usually a lot of issues related to noise. What can we do to help with volume control? Secondly, I had the opportunity to develop a free online building capacity course with Dr. Sarah Nielsen from the University of North Dakota. We developed this in 2019. It was funded by SAMHSA. And you can go online. I'll be giving the link for you. And this free online course provides 5 one-hour webinars covering all aspects of Every Moment Counts with facilitation guides that you can use in a small group of OT practitioners or interdisciplinary school professionals to actually learn about this tiered approach and our initiatives over. You can take several months or several weeks to finish this course. And so just in terms of building capacity, and does it work? So as a part of the grant, we implemented this 6-month building capacity process throughout Ohio, reaching over 200 OT practitioners. And we completed a mixed method study looking at the outcomes. What we found is there were statistically significant improvements in OT knowledge, their belief that they should address mental health, and their actions. And the qualitative findings were really so interesting. I love mixed methods because you really hear the voice of the practitioner. And what they wrote over and over again is they felt more confident. So knowledge leads to confidence. Confident in articulating their role and then truly addressing mental health in their everyday practice. So building capacity is critical. So thirdly, as we already mentioned, really making an effort to articulate our role related to mental health and how we focus on participation, and then also demonstrating it. So that's pretty much what I've been talking about today.
Yeah, and I think that, you really highlighted how if we have knowledge, we feel more confident. If we're confident, we're more likely to act and put that knowledge to action. So I think that these are very, and I don't want to say easy, but these are feasible ideas that people can do to make a change. And I like how you said, just pick one thing.
Yeah.
It's one step in the right direction. And even just saying, I'm going to go into the cafeteria and look and see, what's going on with this kid on my caseload. Mm-hmm. That's where it starts. And yes, The cafeteria is very loud.
Right. We can really make a difference in shifting the culture, which that's where our strength is knowing how to analyze the environment. We're really comfortable in doing that and good at it.
And think about shifting the culture is extremely powerful. That is something where you have a vast amount of power in terms of making a difference. And that's why everyone became an OT, right? We all wanted to make a difference. Right. You're not just making a difference for one person, you're affecting that whole school. So this is great advice. I love this. I think it's exciting. It gets me excited of let's get out there and show what we can do. But this is Pediatric Pioneers, and we're talking about you as a pioneer, but anyone can be a pioneer. And that's the whole point of this is taking this and showing you can do it too. So I would love to help the audience apply it by talking about some success stories. Who has made a difference just by kind of increasing their knowledge, increasing their confidence, and putting that into practice?
Yeah. One of our mantras is everybody can be a change leader. And a change leader is a person who has the knowledge and confidence to do something that's needed to be done. So on our Every Moment Counts website, we have probably about 12 short video vignettes. They're all 3 to 5 minutes depicting OT practitioners in collaboration with other school personnel, such as principals, school counselors, implementing various aspects of Every Moment Counts. So You could go to the Every Moment Counts YouTube channel, and they're all there together. That's an easy way to access them. But what we made sure in doing these video vignettes is the OT practitioner would identify themselves, and definitely from a marketing standpoint, that they're occupational therapists. We need to let others know that this is an OT talking. So one, Leslie Falkinder is an OT in a Cleveland area school, and her video, she started embedding mental health literacy she was doing a lot of self-regulation, sensory processing kinds of small groups with students with multiple disabilities. And the video that you see is she's embedding mental health literacy, talking to the children about what positive mental health is, what it looks like on the outside. And part of that is affect. You can really look at a person's face and kind of get a sense of how they're doing emotionally. So she talks about what positive mental health is, what to do to take care of it, and what to do if you're struggling. So in that little video, there's a young boy, autistic, who has sound deafening headphones, and he was really nervous during that video presentation. The videographer was a situational stressor. He told Leslie he was worried he was going to ruin the group. And so what she did before the group is some pre-teaching of some coping strategies. He could use the sound deafening headphones, he could rock in place, or he could tap her leg and ask to be excused. Well, he got through the group, and he was so proud of his ability to do that. So that's an example of embedding mental health strategies. Another example, Marta Kilrain, she's an OT in New Hampshire, and she was excited about mental health literacy too, and thinking, what could she do? So she met her school nurse and said, do you want to do something together related to mental health literacy? And she had an OT student at the time who also helped with this project, but it's still going on, and they called it Talk About It Tuesdays with third graders, where the nurse would read a story related to a topic related to mental health. Might be bullying, it might be feeling stressed. And then Marta would add an activity to reinforce that concept. So one I think, group book was about kindness, and then they made kindness like catchers, little types of things. So that's another just great example. It's simple. It didn't take a lot of money. David Weiss is an OT in the Cleveland area, and he works in an alternative school with youth, autistic children and youth who have significant behavioral challenges. And what he realized, he was a part of our leisure team, that there were no extracurriculars in his school. And so he met with the principal and said, hey, I want to do something to help these kids have some extracurricular leisure. And he said, can I do Special Olympics? And the principal said, well, help the students. He said, yeah. He goes, well, then do it. So that's an example of ask. Principals need our help. He became certified in Ohio in Special Olympics, and for 10 years now, they've been offering Special Olympics. He embeds his work during PE. They started walking clubs, running clubs, and actually there's a young male he works with that's now running half marathons, and it's changed their family life. They go to neighborhood, events and runs. So that's another success story. Amazing. Jenny Negri is an OT who works at the Cleveland Clinic outpatient therapy. And as a part of the leisure initiative, she realized they were doing all one-on-one therapy. And she and some other colleagues started running small groups for the children on their caseload with disabilities who also, many of them had anxiety, had been bullied at school, and some of them didn't have any friends. So they started a number of groups. The video that's on our website is called the Game Break Group. So that was the first group, teaching children how to play games, but also within that group working on how to be a good friend, and being kind to each other, including each other. They developed since then a horticulture group, all sorts of groups, young artists group. So it can be done in the clinic as well. And then lastly, there are two others. Carol Conway in a school in the Cleveland area. They were doing all one-on-one intervention, and she actually moved and helped the therapists, PTs and OTs, to really move into a integrated therapy model. And they went over a year and a half from like 20% doing push-in to 80%. So it can be done. I think we really just have to make an effort. And then lastly, I think I want to make a plug for therapists involving OT students, OTA students, and now with the clinical doctorate, capstone students to implement some of this work. So recently, an OT student, Chang Mai from Texas Women's University, she was really excited about Every Moment Counts. And along with her OT supervisor, she implemented the comfortable cafeteria for her capstone project in a Houston school. And I will be sharing a blog that the school wrote about what her work. And it was entitled "The Next Generation Occupational Therapists Address Mental Health One Lunch at a Time." And there's also a video that they did. And just one of the things that happened in that school, the kids were being yelled at a lot during lunch and being asked to eat in silence. And that's very typical when there are problems with noise. So what she ended up doing is grouping them in small groups of 4 with a space in between on these long tables. And then with the comfortable cafeteria, within 4 weeks, there was a little boy who was so anxious. He wasn't eating his lunch, and his mother would come in to sit by him so he would eat. But by week 4, he was happy. He was eating his lunch, and there was less stress in the environment. So she was an excellent student, now an OTR. And I just say they can help us with implementation.
Yeah, I mean, that's really exciting to hear that. And talk about 4 weeks is not that long to see that kind of change.
Yeah.
So, at this point, I'm very excited about all the information that you shared. What are your final words of wisdom or inspiration that you could give us to kind of help us on this journey of improving practice in the schools?
Well, I do think this work takes us back to our roots as occupational therapy practitioners. That we started out in 1917 believing in mind-body unity. That which affects the mind will impact the body. So if you're not doing well emotionally, it's going to affect you physically. You might not want to move or exercise. That which affects the body, whether it's a stroke or a disability, is going to have an impact on a person emotionally. So I think tuning into mental health is just core to who we are. So really talking about it, making it a part of your business, of our business as practitioners, and really tuning into, again, those 9 areas of occupation. I didn't mention sleep and rest, but sleep and rest and under health management would be that mental health literacy. So I just really think and encourage all OTs to include addressing mental health as a part of our practice.
Yeah, that's exciting. Well, thank you so much. This has really been not only a privilege, but really exciting topic to think about, changing practice this way and creating a whole group of change leaders in occupational therapy. So thank you.
Thank you, Nicole. It's been a pleasure.
Thank you for tuning into this episode of Pediatric Pioneers by MedBridge. Please be sure to subscribe and listen to more of our episodes on Spotify or on your favorite podcast platform and at medbridge.com. If you're listening outside of the MedBridge catalog and would like to access the bonus resources and receive continuing education credit, Simply log into your MedBridge account and complete the quiz for this episode. Pediatric Pioneers also listens to you. If there is a particular practitioner that you'd like to hear from, or if you have a question or challenge that you'd like to explore on this podcast, please let us know by leaving a comment on our Instagram posts or by emailing podcasts@medbridge.com.